Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, today in this video we can see the questions for exam preparation, and this is a video for a series of questions, and today we can discuss 15 questions in this video, and we will see the question one by one. The first question, Alfred Binet is associated with. Options are option A personality testing, option B intelligence testing, option C aptitude testing, option D value testing. Your question is Alfred Binet is associated with. That is the question. So the correct answer is option B intelligence testing. Alfred Binet is associated with intelligence testing. Okay, Alfred Binet was the first person who developed intelligent test. Okay, so option B intelligent test is the correct answer. Second question, a gifted child has IQ test of, and the options are option A greater than 120, option B greater than 100, option C greater than 130, and option D less than 115. Here our question is the IQ range of a gifted child is. Correct answer is option C greater than 130 is the correct answer. We will see the IQ ranges. According to treatment test, the IQ range is above 140 or above 140 is called genius or gifted children, and the IQ range between 120 to 139 is called very superior child, and between 110 to 119 is called superior children. Okay, and the IQ range is 90 to 109 is called average intelligent, and 80 to 89 is called dull children, and 70 to 79 is called borderline or feeble-mindedness, and below 70 is called mentally retarded. This is the IQ range of according to treatment test. Here the question is gifted child has the IQ is option C greater than 130. Third question, in moderately mental retardation, the intelligent quotient is, and the options are option A 55 to 69, option B 40 to 54, option C 25 to 39, option D below 25. Here our question is in moderately mental retardation, the intelligent quotient is between 40 to 54. Option B is the correct answer. Here we will see between the intelligent quotient between 55 to 69 is mild mental retardation, and they are educable group, and between 40 to 54 they are moderately mental retardation and they are trainable group. Okay, and between 25 to 39 they are severely mental retarded child, and below 25 is called profound mental retardation. They are also called custodial or idiot. Okay, and here our question is moderately mental retardation means the IQ range is between 40 to 54. Option B is the correct answer. The question, which of the following is an anti-sterility vitamin? And the options are option A vitamin A, option B vitamin D, option C vitamin E, and option D vitamin K. Here question is anti-sterility vitamin. Anti-sterility vitamin is option C vitamin E is known as anti-sterility vitamin, and vitamin A is known as retinol, vitamin D is known as calciferol, vitamin E is known as tocopherol, that is called the anti-sterility vitamin, and vitamin K is known as phylloquinone. Okay, here our question is which is the anti-sterility vitamin. So option C vitamin E is known as anti-sterility vitamin. Fifth question, when an infectious disease is spread over the whole world, it is referred to as. Options are option A epidemic, option B endemic, option C pandemic, option D sporadic. Your question is an infectious disease or an epidemic affecting a whole world, or disease is spreading over a whole world, it is called option C pandemic is the correct answer. Pandemic means an epidemic affecting epidemic or infectious disease affecting large section of population and occurs over a large geographical area is called a pandemic. That is, the whole entire world is called a pandemic. And the other option we can see sporadic. Sporadic means case of a disease are widely separated in a space and time and show little or no connection with each other. Okay, it is spreading in a particular space or time is called sporadic. And endemic mean consistent presence of a disease in a defined geographical area is called endemic. Epidemic means when a disease occurs clearly in excess of normal expectancy, it become an epidemic. Okay, epidemic, endemic, sporadic and pandemic. Okay, here answer is option C, pandemic. Sixth question, TB vaccination prevents. Options are option A cholera, option B meningitis, option C typhoid, option D influenza. Question is TB vaccination prevents. Option C typhoid is the correct answer. Typhoid or typhoid fever. This is also known as enteric fever. Okay, and is caused by Salmonella typhi. Here TB vaccines containing Salmonella typhi and Salmonella typhi A and Salmonella typhi B. Okay, this containing Salmonella typhi, Salmonella typhi A and Salmonella typhi B, and the two doses of 0.5 ml vaccination is given subcutaneous route at an interval of 4 to 6 week difference. Okay, that is TB vaccination. Here question is TB vaccine given to prevent typhoid fever. And the seventh question, the first dose of hepatitis B vaccination is given to the baby. Of options are option A at 6 week, option B at 10th week, option C at birth, and option D at 8th week. Here, first dose of hepatitis B vaccination is given at birth. Option C is the correct answer. At birth, the baby is getting BCG vaccine, oral polio vaccine at 0 dose and hepatitis B vaccine. Okay, so here first dose of hepatitis B is given at birth. Eighth question, primary prevention aims at. Options are option A action taken to halt the progress of a disease, option B all measures to limit disabilities, option C action taken prior to onset of a disease, and option D conducting screening test and case finding program. Your question is primary prevention. Okay, this primary prevention aims at action taken prior to onset of a disease. That is the correct answer, option C. Primary prevention means action taken prior to onset of disease. For example, general health promotion and specific protection. General health promotion like health education, lifestyle and behavioral changes, and specific protection methods like vitamin A, iron and folic acid supplementation, immunization, and use of condom in order to prevent HIV and sexually transmitted diseases, and specific protection against occupational health hazards. These are all some specific protection methods. So primary prevention aims at action taken prior to onset of a disease. Option C is the correct answer. Ninth question, the components of oral rehydration salt include all of the following except, and the options are option A sodium chloride, option B calcium chloride, option C trisodium citrate, option D potassium chloride. Your question is which one of the following is not included in ORS solution. Okay, here answer option B calcium chloride is not included in ORS, oral rehydration salt. The ingredients of oral rehydration salt include sodium chloride, potassium chloride, sodium citrate and dextrose. Okay, and its composition also it is there. So sodium chloride, potassium chloride and sodium citrate and dextrose included in the oral rehydration salt. Calcium chloride is not present in ORS solution. Okay, option B is the correct answer. 10th question, Frusemide is administered for. Options are A. Diuretic action. Option B. Vasodilation action. Option C. Antiplatelet action. Option D. Cardiac glycosides. Here Frusemide is an example of diuretics. Okay, it is Frusemide is administered for diuretic action. For example, laxis is a Frusemide which is given as a diuretics. 11th question, which of the following is a long term complication of hypertension? And the options are option A, renal insufficiency and failure, option B, valvular heart disease, option C, endocarditis, and option D, peptic ulcer. Our question is, which is the long term complication of hypertension? Okay, here correct answer among this option, correct answer is option A, renal insufficiency and failure is the correct answer. The complications of hypertension include uncontrolled hypertension include myocardial infarction, congestive heart failure, renal failure, and stroke, impaired vision. All are the complications of hypertension. Among this option, we can select renal insufficiency and failure. Okay. 12th question, the purpose of administering streptokinase to a patient experiencing myocardial infarction is to. Options are option A, keep him well hydrated, option B, prevent infection, option C, prevent renal failure, option D, dissolve clot he may have. Your correct answer is the purpose of administering streptokinase. Okay, here streptokinase is an example of thrombolytic agent. Here we are giving it to the patient with a myocardial infarction. The streptokinase help to dissolve the clot that he may have. Option D is the correct answer. Dissolve the clot he may have. 13th question, the goal of nursing care to a patient with acute myeloid leukemia is to prevent option A, cardiac arrhythmia, option B, liver failure, option C, renal failure, option D, hemorrhage. Here question is, which is the main goal of nursing care to a patient with acute myeloid leukemia? Okay, and the correct answer is option D, hemorrhage is the correct answer. One of the important goal of a patient with acute myeloid leukemia is to prevent infection and hemorrhage. The main nursing goal, first priority is to prevent infection and hemorrhage. And the next we will focus on nutritional status of the patient and the pain and discomfort, and maintain fluid and electrolyte balance, management of self-care, and manage the fear and anxiety of the patient. These are all the main nursing care for a patient with acute myeloid leukemia. Here the goal of nursing care to a patient with myeloid leukemia, acute myeloid leukemia, is to prevent hemorrhage. 14th question, tracheostomy suctioning at a time should not be. Options are option A, 10 second, option B, 20 second, option C, 25 second, option D, 30 second. Here question is, the tracheostomy suction time should not be. Okay, it should not be more than 10 second. Option A is the correct answer. It's a familiar question. The tracheostomy suction should not be more than 10 second. And the 15th question, top priority care after nasal surgery is option A, assessing pain, option B, inspecting for periorbital edema, option C, assessing respiratory status, option D, checking for melena. Here question is, which is the top priority care after nasal surgery? It is option C, assessing respiratory status. Respiratory status or airway maintenance is the first prime most care after nasal surgery. Option C is the correct answer.